Hawaii Pacific Health is committed to creating a healthier Hawaii.
Donations to our hospital support specialty programs and services, some that might not even be possible without these meaningful gifts.
The destination is the same. We're all trying to make an impact in the lives of our patients, their families, and our community.
I'm Dr. Wendy Hirsch. I'm a child psychologist here at Kapiolani Medical Center for Women and Children, and the handler, the very lucky handler for Winnie, our chief canine officer and hospital facility dog. The Hospital Facility Dog program was really started by Martha Smith, our CEO, and Assistance Dogs of Hawaii, so they decided that we needed and deserved a hospital facility dog. It was really kind of a beginning idea to have Tucker was our first chief canine officer, and really the dog that started this huge change in how we saw animal-assisted therapy. He was here for almost 10 years, providing care to thousands of children. And so we continue on the program with Winnie in his legacy, in his honor. Tucker and now Winnie were the best therapists I've ever seen, because what they know is what's true, which is just to be there, present and quiet, available, supportive.
My son is going through chemotherapy, so it can be hard on him, and just getting that visit from a dog takes his mind off it for a little while.
The kids need that sense of comfort. That's a comfort that no one else can give them.
There's something about having her, laying at your feet, or when there's a difficult conversation with a physician, for example, it makes it easier, and that's amazing that we can offer that.
I give because I love our kids.
I give because I want to create a healthier Hawaii.
The Kokua Fund is an instrumental tool that we have here at Straub Medical Center that can provide, whether it's medication, medical supplies, or even travel assistance for patients that come and seek care.
I work at Straub Hawaii Kai Clinic, and one of our longtime patients has been coming in more frequently for falls, and doctor had suggested he use protective equipment, but he didn't have the funds. We had thought about trying to get it through his insurance, but we couldn't find a supplier that carried helmets or elbow pads or knee pads.
I worked the details in the back after doing our thorough evaluation. We got the okay.
He was beyond grateful for the over and above actions that we had taken as a team, and in such a speedy manner. He needed it right now, and we got it within 24 hours. Thanks to Straub and the Employee Giving Campaign and the Kokua Fund, helped hundreds of patients, and will continue to help hundreds more, thousands more.
My journey in giving began when I became a physician. Now I found other ways to give by contributing to the Employee Giving Campaign.
I personally give because I've been given much, and it's an opportunity to give to those who have less.
These days, medication costs so much, and I think some of our patients and family have to make a choice between paying for medication versus putting food on the table. So I think it's important that we do what we can to help our patients in the community.
All across the country, the emergency departments are kind of the fail-safe part of our healthcare system, so we're taking care of people who can't get into an office, who may not have any insurance at all and may not have any way to care for themselves.
Once I had a patient that had some heart issue. He didn't want to ask for help. Looking at his financial needs, we offered that to him. He was thankful for it, and also you can read people's body language that they're grateful for what we can do for them.
Participating in employee giving campaign is a way to deepen my connection with something I believe in.
Being in the hospital is such a tough experience. There's so many things that are changing. People have lost control of so many things that they sometimes wonder why me, why am I here today? And having a chaplain can help to answer some of those questions. First and foremost, a chaplain's role is to kind of just sit and talk and listen, which is something you don't get much in the hospital, obviously. Everybody's kind of in and out quickly, and they all have important jobs to do. But a chaplain can really sit and spend time with the patient and family.
I think a lot of times people think that the chaplain program is only for the patients or for the family, but I'm really excited to make sure that the staff know that I'm here for them.
There's actually a well-recognized thing in healthcare called secondary trauma, which means that the caregivers, the nurses, the physicians, the aides, they are traumatized as well. But they're professionals and they may not show it. So having the ability to have a safe person whom they trust as a member of their staff is an incredible support.
It can help you get back on your feet. It can help all the staff get back on their feet and work better so that the next time another trauma comes through, we're prepared and ready for it.
I think it's a real affirmation to find out that the chaplaincy program has been selected is really a reminder to me of how valuable it is, that they're excited to make sure that there are resources here to continue the program and to allow for it to grow and develop over time.
We should all explore why it's important to give because it benefits our patients, their loved ones, and their ohana.
Thank you again for being a part of this journey with us.
Remember, no matter the amount, every gift counts. Together, we can make a difference.